Hello, everyone. On today's episode of Trust the Process, we are here with Deja Fur, who is a student at Herzing University and is enrolled in the sterile processing program. Today, she will enlighten us on the complexity of sterilizing complex instruments and more. If you want, you can take a few minutes to say hello, Deja, to everyone before we dive in.
Hi, everyone. First of all, thank you for inviting me here. I'm excited to share this new knowledge that I have about, complex instruments and what it takes to sterilize them. And I am ready for the questions when you are.
What is a complex instrument?
So a complex instrument is more of a sophisticated and delicate instrument, and it's usually used and paired with common surgical instruments, things like forceps and scissors, retractors, and etc. They're used together. Some examples of complex instruments would be things like drills, saws, endoscopes. Drills and saws are typically used in surgery to cut through things like bone and tissue. And endoscopes were used to examine things like body cavities and organs. Those are typically used during surgery for like less invasive procedures.
Okay.
That way the person won't have to, they won't be left with a bigger wound when using things like endoscopes, because the surgeon can see where exactly they need to go, and it'll be a bit more precise.
Okay, that's interesting. Is there anything else we should know about complex instruments?
Well, complex instruments, they are a lot more expensive. Not even just in the purchasing aspect, but also as far as repairs. Because they are, as their name suggests, complex and a lot more complicated, and their parts being more delicate, they're more likely to be broken either during sterilizing or processing or transport or things like that. And because their components are so difficult to repair, the expenses for those are pretty high. Another thing about complex instruments is that a lot of them come with multiple parts. Some of those parts are really small, some are bigger, some of them can't be cleaned the way regular instruments can be cleaned, which I'll end up talking about later, I'm sure. But that's also another thing. And another thing I would like to add, which I thought it was a lot more, or something that I thought was really interesting when I first started studying sterile processing, is that they're actually more likely to be improperly sterilized compared to regular instruments like, the forceps and scissors. And that is because they have multiple parts that are harder to clean, so they're more likely to be improperly sterilized. Sometimes the debris may not be fully cleaned. Those hard to reach places might still have some debris that might go unseen. So that can lead to even more problems, if that is a failure that isn't caught before it's, sent off to be used in a procedure. You have a contaminated instrument being used on a patient during surgery. That leads to other issues, such as HAIs, which are hospital-associated infections. And that's not even the patient's fault. That's on the fault of the hospital and the facility. So it's really important to make sure that those instruments are cleaned properly to avoid several different incidences.
Wow. Is there, you may or may not know this question, but is there a high percentage rate of those infections occurring because of the improper sterilization?
Hospital-associated infections are actually, unfortunately, common in hospitals, and that could come from a variety of different things. It could come from just simply patients being around other sick patients. You have those pathogens, no matter how much, things may be cleaned or disinfected, there's still a possibility that they are moving around and essentially being I guess you could say, transported to other patients. So that also leads to it too, but also instruments not being properly sterilized. I'm sure that is a high percentage. Mm-hmm. And I actually remember doing a discussion post for one of my classes, and I believe the topic was complex instrumentation. And one of my classmates, I guess through some of the research they did, it showed a really high percentage for complex instruments that would go improperly sterilized. And I can't fully remember the percentage, but I want to say it was at least over 30%.
Wow.
So that's something that's unfortunately very high, but also an issue that needs to be tackled as well.
Okay, wow. It's interesting. Okay, so now that we have some knowledge about complex instruments, with you going into detail about that, what they are, how much they cost, etc., what makes cleaning them so complicated?
Well, to start off, I think it's better to talk about what it's like cleaning regular instruments.
Okay.
When you have things like forceps and scissors and retractors, like I mentioned earlier, those items are usually pre-cleaned beforehand. It's called point of use cleaning. So after the surgery, they'll be wiped off with a sponge. According to the Aorn Journal, they can be wiped off with a sponge, or they can use water to irrigate instruments with lumens. That way this can get rid of a lot of the visible debris, so like the tissue and whatever fluids are left over on the instruments, because the last thing you want is for that soil and that debris to stay on the instrument and then get stuck and then harden, because that makes cleaning them 10 times more difficult to do.
Okay,
so most instruments will have that pre-cleaning phase, and some of those can be, soaked in water, forceps and things like that. You could soak that in water and it'll be fine. But versus complex instruments, a lot of those are things like power drills and saws, and like I mentioned, endoscopes. Those have powered components with electrical parts and things like that. That can't be submerged in water, because that can lead to damage of those instruments. And since those are already expensive, who wants to go and buy another drill or another saw?
Right.
So those instruments have to be handled with a lot more care, since they're a lot more delicate. So when cleaning things like that, they have to be disassembled, and they can come with many different parts, all delicate, and those delicate parts have to be separated. And with powered instruments, like I said, they can't be submerged in water due to the electrical components and the power cables. So a lot of those will typically have to be wiped down, and you have to ensure that all the lumens are properly cleaned with the right brushes to really get inside. And it can be difficult to see if all the areas have been reached and all the areas have been cleaned properly. And if you don't pay enough attention, things can go unnoticed, and that can lead to instruments being labeled sterilized when really they are still contaminated.
Wow. So how much time would you say you could end up spending on one complex instrument?
One journal that I saw, it mentioned the drying time for instruments. A regular instrument could take maybe 5 or so minutes, in its drying cycle. But for a complex instrument, it could take anywhere from 10 to maybe 20 minutes. So that's a lot of extra time going into it being dry. And in some cases, it may not come out fully dry. And that could lead to things like wet packs. Now, those are instruments that are still wet or still have some form of moisture on it after the whole sterilization process. And the thing with wet packs is, even if an instrument has gone through all of the sterilizing process and the entire cycle, if there is still moisture inside, there's a possibility that that instrument is still contaminated. When it turns out that an instrument is a wet pack, water can be, well, let me start over actually. When you have an instrument in a package, it's safe from debris and contamination. Right. But when there is water present on the package, that water can be used as a transport for microorganisms and pathogens. So when you realize you have a wet pack, even though it could be fully clean, but that water on it there's still a possibility it's dirty. So once again, you have to take that instrument out and you have to go through the process all over again. So that's more time wasted, more resources wasted. And yeah.
Wow, that is so interesting. Wow, okay.
And also another thing to be considered is also the testing. When you have things like scissors and chisels, things that are made for cutting, those are tested for sharpness. Now, those tests are usually pretty simple. I believe for the scissors, they have to be able to cut a piece of material in one clean slice, no snagging, and it has to go in one fluid motion. Chisels, they have to be able to scrape a certain amount of a product and things like that. But when you have instruments that come with hoses, those have to be tested for leaks. And the testing for that can be pretty lengthy as well. And if the test comes back positive for a leak, now you have to redo that whole test over again to make sure that there's not an issue with the actual hose. And if there is, then that instrument has to go out for repairs, and then you have to find a replacement instrument. So a lot goes into making sure the complex instruments are sufficient enough to be used during surgery.
Okay, so I'm just sitting here thinking about all of the stuff we just went over with these instruments, and I never realized that there were so many challenges regarding sterilizing instruments, specifically the complex instruments. So considering all of these obstacles that sterile processors face when sterilizing these instruments, what would you say would be a good solution?
Well, I've thought of a few. After doing my research for this assignment, specifically for complex instruments, one thing that I think is something that really needs to be considered is certification. Not only certification, but also experience in hand with the certification. One article that I read, I believe the author, her name is Donna Swenson. She was talking about improving sterilization, the quality, and things like that. And one thing she mentioned was how, I guess there's a lot more pressure for people to become certified when working in the sterile processing department. But she mentioned that those that are certified don't necessarily have as much in-field experience. So they may come out with that, that golden certification, but when they're in the field, they may not have as much knowledge and really know what to do. And that could lead to, errors and things like that, which is the last thing we want. But then on the other hand, you have people who are experienced, who have that knowledge, but she even mentioned in there they may be knowledgeable, but then they can't pass the exam because they may not know all of the technical stuff. So I don't think you should have, one without the other. I think that certification is important. Things are always changing, laws, regulations, and things like that. So you should have that knowledge. But I think it's also important to have that hands-on experience as well. Because you may know everything on paper, but when you're in the field, things happen and you need to know how to react to certain situations. I like to think that I'm lucky enough to be in the program that I'm in, because not only will I be leaving with, my diploma and the knowledge I've gained from this program, but I'll also be doing a boot camp later on, so I can get those hours of experience. And it'll help me feel a lot more confident. And I'm sure that if this was something that was implemented in a lot more programs, that the other students would come out feeling a lot more confident as well.
So if you don't mind me asking a question, so do you know, as people are doing this job and being in this field, when things are changing, do you guys have to take other courses to keep up with the changes that may occur, or is that something that they just provide on the job?
A lot of facilities and companies will provide that extra knowledge. for the employees. As I stated earlier, laws and regulations and things like that are constantly changing. They are finding new ways to clean things, new ways to get things done quicker and on time. So with things ever changing, you will be notified of changes and things like that, and you'll be given time to learn and come accustomed to those things. And that's also something that's important for a sterile processor, is to be able to adapt. Things change all the time, and as harsh as it sounds, you need to be able to adapt and basically be on board with it. So yeah, definitely.
I know we all hate to have learned something and then
the next day it's different.
You have to start over again.
And another solution would be to have up-to-date IFUs. Now, IFUs are instructions for use. They're basically like the instruction manual. And a lot of things have IFUs, from the equipment, instruments, the solutions that are used to clean the instruments. It's really important to make sure that they are up to date, because those can change as well as products change and things like that. One article that I read, the author Susan Classic, she also talked about IFUs and how they're used in the central service department. And she mentioned their importance. IFUs, in conjunction with instruments, will tell you, how to clean the instrument, what products to use to clean the instruments, whether it should be manually cleaned or used in a mechanical cleaner. And if those aren't as clear, or if they're not up to date, you could possibly end up cleaning those instruments incorrectly. And with things like complex instruments, since they come with multiple parts and they have to be disassembled, they can even also show you how to assemble the instrument, so you're not just guessing and trying to figure it out yourself. It'll even tell you how to do it. So I think it's important to have the IFUs be up to date, and also have really clear, detailed instructions, so that there is no guesswork for the sterile processors. They're able to look at the manual and see, this is how it needs to be done, this is how you do it, and it should look like this. This will be the finished product. So yeah, I think those the certification experience and also the proper IFUs, I think those are like some real solutions that could be used for the central service department.
All right, well said. Okay. All right. So today we went over complex instruments, what they are, the challenges with cleaning them, and Deja even went over some possible solutions to this crisis. So we had a great time, and I think we all can learn something from this and have a greater appreciation for those that work in central services. Thank you for your time, Deja, and we really enjoyed having you today.
Thank you for having me. I really enjoyed myself too. This was a lot of fun.
All right. Maybe we can bring you back.
Just let me know. I'll be back.
All right, will do. Until next time, everyone. Thank you.